Welcome back to On Point with Juandolyn Stokes, right here, News and Talk, WAOK. We're so glad to have Georgia State Representative Sam Park with us. How are you, Sam? How
Good
are you
mor-
doing?
Good morning, Juandolyn. I'm doing as well as can be.
I'm glad to have you here sharing with us today. Representative, you have been always, committed to Georgia, and you actually fight for justice and the rights of Georgians. But also, so one of the things that's very dear to you is health care for Georgia. So let's start with that. Talk to us about the impact of Trump's health care and even food assistance cuts will affect Georgians.
Absolutely. So these are big numbers and really big changes that are headed our way. And I think it's always important to take a step back and really understand the human impact and cost that this is going to have on everyday Georgians. For me, healthcare is personal. Healthcare is a matter of life or death. Almost 10 years ago, my mother was diagnosed with stage 4 cancer, and it was public health insurance, Medicaid, and Medicare that gave her a fighting chance. And so that's what we're talking about with respect to these really draconian healthcare cuts that are headed our way. The one big beautiful act, HR 1, that Trump and congressional Republicans passed over the 4th of July weekend. This is the biggest cuts to Medicaid we've seen possibly in the history of the United States of America. $1 trillion of Medicaid cuts. Medicaid, just so folks can reorient themselves, this is medical aid for the least among us. There are seniors, there are children who are depending on Medicaid for basic healthcare services, and this bill is going to gut almost $1 trillion worth of investment over the next 10 years. Georgia is projected to lose about $2.29 billion. And so we're talking about hundreds of thousands of additional Georgians who will start losing access to healthcare coverage. Now, of course, Georgia is also one of the few states in the country that has not yet expanded Medicaid. And so some folks may be saying, oh, we are a non Medicaid expansion state. How are those Medicaid cuts going to hurt us? Well, this big beautiful bomb of a bill, this big ugly bomb of a bill, I should say, it doesn't just impact the Medicaid population, it impacts Georgians who have purchased health insurance on the marketplace. Um, and this is the more immediate impact of this legislation that I think a lot of folks need to be aware of. By the end of this year, Affordable Care Act healthcare premium subsidies are set to expire. So 93 to 95% of all Georgians who have purchased health insurance on the federal marketplace or the state marketplace, they are set to lose those tax credits, those subsidies that help lower the cost of health insurance. And so what does that mean in terms of people's everyday pockets? We may see premiums increase by more than 75% in 2026. We may see healthcare premium costs double in certain instances. And so, what is the effect that that will have? That means that we may start seeing Georgians with private health insurance today, due to these increased healthcare costs, start losing their coverage beginning at the very beginning of next year, right? Already, there are multiple reports saying that healthcare insurance premium costs are going to increase by 20% starting this year during open enrollment on November 1st. And so this is a really dangerous and dire situation, especially for those who are in need of healthcare services. But across the board, this is going to, I'm very, very concerned that this is really going to have, devastating consequences across the state.
So will it cost pretty much the same if you're in right now if you have it in the marketplace on the state level or the federal level as opposed to getting with a major insurance company?
So a lot of the major insurance companies are on this marketplace exchange. And so more likely than not, for the hundreds of thousands of Georgians who've received healthcare through one of these marketplace exchanges, going to healthcare.gov or the new state portal, those premiums for all those private health insurance plans, they are likely to now increase. So folks, if they can't afford these increased costs that will start likely at the during open enrollment November 1st of this year, folks may end up losing private health insurance. And again, those cascading effects, we're going to see more uncompensated healthcare costs. We're going to see more strain on hospitals and especially rural hospitals. And so it's a very concerning situation in which I think it's important that we're paying attention exactly what's happening and the root cause of this. A lot of this, in my opinion, is otherwise unavoidable, right? Everything should not be political, certainly not access to healthcare, but there is a very clear political divide on the issue of healthcare in America and in the state of Georgia. On one side, you have Democrats from President Obama, who passed the Affordable Care Act that covered more than 20 million Americans.
Yeah.
On the other hand, it's the exact opposite under Trump and the Republican Party, in which they've passed legislation that will make millions of Americans, hundreds of thousands of Georgians, begin to lose healthcare coverage. And so we as Georgians have to be very, very clear-eyed again with this situation, what's headed our way. So one, we can mitigate as much harm as we can. And then two, use what power we have. Use the power of the vote to make sure we're holding our elected officials accountable and otherwise moving our state and our country forward,
How
especially on
do you
these
do
important
that?
issues.
How do you do that? Holding, people accountable. How do you fight in that regards and hold them accountable to make sure? Because sometimes, once they get
Mhm.
elected, they do something totally different.
Right.
But what are your recommendations on that?
Especially as a Georgian born and raised, I believe in the principle of John Lewis that the vote is the most powerful nonviolent change agent we have in a democratic society and that we must use it. My own experience, I think, is a great example of this, in which, I don't come from money, I don't come from a politically
Yeah.
connected background, but in 2016, I jumped into a race and I ended up beating and unseating a three-term Republican chairlady back in 2016
Yeah.
on issues such as Medicaid expansion, on ensuring comprehensive civil rights protections for every single Georgian, on ensuring that we had good jobs, an economy that works for everybody. And so my own experience is a reminder that democracy, while strained and under assault, still remains viable. We can still do what we can to hold all of our elected officials accountable, in which we are, eligible, or we are up for a vote for a reelection every 2 years. This is
Right.
the
Right.
opportunity for us to, right, hold folks accountable and to build power.
I want you to go back and elaborate on what you were talking about with Medicaid here in the state of Georgia. Well, how will people be impacted with that? Because we don't have extended Medicaid here.
Mhm. So a lot of the provisions in HR one, the big ugly bomb of bill, which I will call it that, these a lot of the cuts and implementation of the Medicaid pieces are intentionally delayed. So, for example, a lot of the really harmful Medicaid cuts in particular are set to begin in 2027 after the 2026 midterms, which is a clear effort, in my opinion, to avoid accountability, to kind of kick the can down the road, to ensure that whatever harm may come about as a result of HR one is, the next administration or the next Congress is otherwise held responsible for. Um, all for what purpose? All so that they could essentially get a massive, massive tax cut for the wealthiest Americans and the wealthiest corporations in this country. And so, on the one hand, with the Medicaid cuts being intentionally delayed, I think that does provide an opportunity to mitigate harm. But again, we still have this challenge when it comes to private health insurance, in which we may still see costs going up and a lot of cascading harmful effects beginning to occur at the beginning of next year.
I say. We are live. We are broadcasting live here on WAOK. We're also streaming live on our WAOK YouTube page, as well as on Facebook. We'll go to break and we'll come back and we're going to talk about how Georgians will be impacted by food, the lack of food assistance, and other matters that are on the heart of Representative Sam Park. We'll go to break and we'll be back with more on News and Talk WAOK. Representative Park, tell us about, and because you were alluding to it earlier, about your experience when you even came into, this political climate? What led you to come into and fight for Georgians? What did you see happening at that time that led you in the political race?
Absolutely. So, back in 2014, almost a decade ago, that's when, the state of Georgia and many other states were debating whether or not we should expand Medicaid or whether or not we should continue to, sit back and see what other states decide to do.
Hmm.
That year, Republicans in Georgia made it more difficult to expand Medicaid. They actually passed a law that would require the legislature, as opposed to the governor, to expand Medicaid. And really, for the next 10 years, they haven't done much, certainly with respect to addressing the largest healthcare challenge that I see, which is having one of the largest uninsured populations in the state. That exacerbates, again, uncompensated healthcare costs. These uncompensated healthcare costs, where do they come from? If you don't have health insurance, then only when you are on the brink of serious injury or illness do you end up going to the hospital or the emergency room. Even if you can't pay, right? Hospitals and emergency rooms under federal law are required to cover your healthcare services. And so that creates then this massive amount of healthcare services that are essentially going unpaid for, which is one of the primary strains, one of the primary factors as to why we've seen, I think, probably 10 hospitals close over the past decade. If you look at other states like Arkansas that did expand Medicaid through a private model, not a single rural hospital in Arkansas shut down compared to Georgia.
Wow.
And so, in really understanding this, big healthcare policy debate, it suddenly became very personal to me when my mom was diagnosed with stage 4 cancer in December of 2014, where, again, it was Medicaid and Medicare that gave her a fighting shot. Given how far her cancer had spread, she had to go to chemo 2 times a month for 6 to 8 hour infusion treatments, and her healthcare expenses were about $30,000 a month. There was no way that my family could have otherwise, covered those expenses. But again, public health insurance, I mean, that entire experience really taught me that public health insurance, Medicaid and Medicare, these are life-saving policies. These are life-sustaining policies, in which if my mom was not 65 years old and eligible for Medicare, I would have lost her in a few months. If she did not have access to Medicaid that covered 20% of the healthcare costs that Medicare does not otherwise cover, again, I would have lost my mother in a few months. She surpassed all expectations. Um, and so I think, again, when folks are listening about information to this debate and this issue, ultimately I want folks to really understand that this is personal. This is a matter of your health, your livelihood, and that of your family members, of your mother, your father, of your children. That is ultimately what is at stake when we're talking about access to healthcare in the state of Georgia and in this country.
Yeah, I mean, this is a very problematic. If you're a resident of Georgia and you're listening right now, as we're talking with Georgia State Representative Sam Park, we're talking about how this bill will impact residents of Georgia, and of course what we can do. So you've already stated, Representative Park, about health care. What about food assistance here for Georgians? How will they be impacted?
Very similar to these massive healthcare cuts. We're likely to see a lot of cuts to SNAP benefits that will make it even more difficult for folks to receive the food assistance that they need. And so, this is yet another very dire situation when it comes to basic necessities. Um, so, you know, I know in Georgia, for example, over the past few legislative sessions, one of my colleagues, Representative Amani Barnes, had been working very, very hard to ensure that here in Georgia, for public schools, we are providing free school lunches to
Yeah.
ensure that children have an opportunity to eat. Um, Unfortunately, Governor Kemp and some of my Republican colleagues thought that no, the state shouldn't be otherwise be assisting in that capacity. Um, with HR1, we're now seeing massive cuts to SNAP benefits, or supplemental nutrition SNAP benefits that, again, I think are going to be incredibly, incredibly damaging to everyday Georgians.
Representative Park, what is the strategy? Yeah, like what can Georgians do? Because this is reality. And so you talked about the enrollment program that's coming up November 1st when it comes to healthcare in the marketplace. These SNAP benefits and those cuts, when will that take effect?
So I think the SNAP benefits, I'm not as familiar with them as the healthcare benefits, but my
Okay.
understanding is that these will be coming into effect pretty soon. Some highlights would be that, we'll see a cut of approximately $100 per month for more than 600,000 households, according
Hmm.
to the Center on Budget and Policy Priorities. This new legislation also expands work requirements for SNAP recipients, which may potentially impact older children and people between the ages of 55 to 64 years old. And so ultimately, these cuts to SNAP benefits will likely only increase the food security that already exists, especially in places around the state
Yeah.
that are already struggling to begin with. I think some studies have found that these cuts to SNAP would affect over 750,000 people, as I'm sorry, 154,000 people in the state of Georgia, on top of 750,000 Georgians who would likely lose healthcare coverage.
I see. So one of the things that you recommended is that people vote, and that people hold, these leaders accountable. What else can people do with this coming down the pike?
So I think, the general election, of course, or the midterm election, of course, is, more than a year away still, right? November 2026. I think, now is a time in which we need to start getting organized, right?
Okay.
We need to start talking with our neighbors. We need to start connecting with our community nonprofit organizations who are on the ground serving these communities in the first place, certainly when it comes to nutrition, but even your community co-op. All of these are going to be, in my mind, critical organizations and entities that end up on the front line of mitigating as much harm as possible when we see these cuts starting to go into effect. Um, and so, I think between now and November of next year, as community members, as fellow citizens, we have to do what we can to take care of one another and to mitigate as much harm as we can. Second, we have the 2026 legislative session that will kick off in Georgia in January of next year. And, as we move into the fall, we'll begin preparing in terms of, what key legislative policies Democrats and Republicans will be introducing, proposing, and then trying to pass. Especially if we see some of these federal policies trickling down to the state level that causes a lot of harm, I do think there's an opportunity for the state of Georgia to step up and to mitigate this harm, whether it's access to healthcare or whether it's access to food and nutrition, and of course housing and many other basic necessities that, as we've seen in other states, step in. Hopefully, the state of Georgia will also demonstrate the leadership necessary to step in and ultimately put the people first to ensure that their needs are ultimately being met.
And that's very key. We're called to serve people
That's
and
right.
to be conscious of what's happening with people. So that's why you look at data, look at what's going on, and so this is how I can help people and move people forward. Do you think that the effort of this by the Trump administration and congressional Republicans is to just give tax breaks to the wealthiest people and not worry about everyday people?
Yes, I think it's been very, very alarming to see both state and federal Republicans act in a manner as if they will not be held accountable. And we see very clearly how they intend to ensure that even if they are harming their own constituents and people, Democrats and Republicans who may have voted for them or not voted for them, we see what they're trying to do to avoid accountability, to avoid transparency. The most clearest example is, this redistricting effort in which, Trump is calling on Texas Republicans to provide him 5 more congressional districts. That very much sounds like the call that Trump made to Secretary of State Raffensperger of, hey, help find 11,000 more votes in the state of Georgia.
Yeah.
Right? This is undemocratic. This is un-American. This is blatantly authoritarian. And so we have to understand and recognize that not only is there a lot of harm coming our way, there is an administration and a political party today, the Republican Party, who is doing everything within its power to ensure that they are avoiding accountability, avoiding
Yeah.
responsibility for the harm that they are now causing. And so, again, people need to be clear eyed, not just in terms of the rhetoric, right? Especially with elected officials. Never just listen to what they say, look at what they do. Look at the impact that legislation and law enacted and passed by Republicans and Democrats, but look at the impact that they have on your daily life, right? Because ultimately, we are a nation in which we the people govern ourselves, right? The government is supposed to act in our best interest, and we're seeing that understanding begin to break apart. And
Yeah.
so we have to, especially in this moment, we have to understand that this is a dangerous period of American history, in which it's not just the immediate harm that we're going to see beginning to occur, coming down the pipeline, but that if we don't take back power for the people, right? If our government is not responsible or responsive to the people that it's supposed to serve, then again, we're heading down a very, very dangerous path. That now is the moment in which we have to stand up and do everything possible to push back against.
Yeah, yeah, we do have to stand up. What would you like to see from Democrats happen during this time? Do you think
From,
Democrats need to stand up more?
I think it's critically important for Democrats across the board to, one, stand and fight for the people, knowing what's coming down, and then two, to be very intentional with finding common ground. You know, the Democratic Party, we represent the diversity of the state of Georgia, the diversity of the United States of America. And that diversity, in my opinion, is a strength. It highlights our shared values, our shared hopes and dreams, and allows us to, move beyond, to transcend, to elevate ourselves amongst, past the tribalism, past, simply seeing a person based on the color of their skin, and actually trying to focus on character, focus on American values that have always served in many respects, even in difficult times, as a North Star of ensuring freedom for everybody, of ensuring equal dignity for everyone, ensuring justice and fairness for everyone. I think those are things that we still must fight for. And I think Democrats across the board understand and share those values. I think Democrats today really have to take on the mantle that we are the party
Yeah.
that represents and is fighting for American democracy. But now is a moment, I think, in which we have to be that we do have to stand and fight, to do so strategically, but ultimately with every intention of winning, because there's so much at stake right now.
Yeah, yeah, there's a lot at stake. How would this pan out? I mean, if people don't have health insurance, if they don't have food supplemental food programs, then people will not be spending money in the economy. People are going to cut back. So, how is this going to pan out and work the way they think it's going to work? Because people, if they don't have it, they just don't have it.
Mhm. So I'm not going to put myself in the mind of a Republican, but we,
Just a
but
general statement.
yes. Well, I think we got a sense of what Republicans thought would happen from the first big tax cut in during Trump's first administration. What did that ultimately do? It did not generate the kind of economic growth they said it would. It added billions, if not trillions, to the national deficit that's made the current economic situation even more precarious with respect to inflation rates and the inflation rate with respect to the bond market, with respect to the loss of value of the dollar. Um, and so, what happens between now and next year? I mean, I think there's a lot of economic data right now that's painting a worrisome picture. I've read many articles saying, hey, we may be in a period of stagflation. Hey, there may be greater economic pain coming our way. Ultimately, I think if I take a step back, if folks continue to be not only harmed but ignored, I think again that really undermines the stability of our country, in
Yeah.
which this is a moment in which hopefully that will galvanize us to come together and make the necessary change. But again, at what cost? Um,
Right.
you know,
Right.
all of that to say, I think, with what we've seen from the first few months of the Trump administration, this is not normal,
Right.
right? And we
Right.
cannot normalize it. And I think if we continue to go down this path, especially come 2028, and 2028, that's 3 years away.
Yeah.
But if we don't see a significant change in terms of our trajectory as a country, I'm very very concerned as to whether or not we'd be able to come back from this sort of authoritarian
Wow.
regime in which you're again, Trump said it before many, many times as well. Hey, once you elect me, you won't have to have an election again, right?
Yeah. Yeah.
Our
Yeah.
our country is at stake.
Yeah, absolutely. Yeah, our country is at stake, and you raised a very key point that we may not be able to come back from this. Yeah, so I certainly appreciate your passion for Georgians and your continued fight and commitment to making sure that we have justice and things are that the people are served. Representative Sam Park, how can people follow you, connect with you? Your website? How can people stay in touch with the things that you're doing?
Sure. So feel free to follow me on social media. My website is samforgeorgia.com. My Instagram is repsampark. Google my name, Sam Park, Georgia. I'll pop up. Definitely feel free to reach out. Again, this is a moment in which I'm going all in
Yeah.
to organize, to do everything possible for the people to understand, again, the moment that we're in so that we can respond with wisdom, with strength,
That's
in
good.
service to our fellow neighbor. Um, because again, the stakes are so high. If ever we are going to stand up, now is the moment in which we have to do so. And despite the dire picture that I paint and that, the dire situation that I think is headed our way, I remain hopeful. I
Yeah.
remain, bullishly optimistic that, the strength of our country is ultimately our people. And
Yes.
as a Georgian born and raised, I know we have so much strength as Georgians, and I see it every single day. Right, given the resilience of folks from all different backgrounds and communities, trying to make this a better state, trying to love their neighbor and ensure that we're living up to our highest principles and values. And so I know we can do this.
Yeah.
But again, this is the moment in which we have to really get serious. We have to be clear eyed and work collaboratively in partnership with one another to stand up, fight back, and take back power for the people.
I love it. I love it, Representative. Thank you so much. And we're going to continue to do this. And always, listen, we'll check in with you because we want you to keep us updated with a lot of the work that you're doing for Georgians. Thank you so
Absolutely.
much. Have a
Thank
great one
you.
now. All
You
right.
too.
Stay healthy, stay connected, stay on point. It's on point with Juandolyn Stokes. We had just had Georgia State Representative Sam Park sharing with us. We're going to break and we'll be back with more.
Thank you, Juandolyn.
Thank you. Have a good one. I always love talking to you.
Always a pleasure. Thank you so much as
All right.
always.
Love you so much. Take care. Bye
Bye.
bye. We are live here on WAOK, and of course, you can tune in to WAOK on point with Wandle and Stokes. We are weekdays, 10 a.m. until 1 p.m. And of course, we're on iHeartRadio as well. So if you have that app, you can certainly download that app as well and tune in. The Audacy app, iHeartRadio. You can go to WAOK.com. We are News and Talk. Loving every every moment to be able to share it with you and to bring you news. Well, stick around because we're going to come off of here, but coming up very shortly will be our Medical Monday with Dr. Joffrey, which is every Monday from 12 to 1. Also, make sure you're tuning in because we have more news and conversation. Also, if you're a listener and you want to join some of the conversation that's happening here, because I do love hearing a lot of the insight from many of you, 404 is the number to call. That's 404-726-1380 is the number to call. So I'm going to now go back live on air and we'll check in with you the next time. This is your friend and sister girl, Juandolyn Stokes. Make sure you keep it positive.